valvular heart disease program is really part of the larger program in a whole called structural heart disease. What structural heart disease means, everything kind of relating to the structure of the heart. Our goal is to be on the forefront of all the options that are available to really help match the best option for the best patient for what their valvular problem is. One of the most unique things about our valve program here at CentraCare is the way we approach patients. We do an incredible job with kind of a minimalist approach, basically trying to find the best way to fix someone's problem with making it as less complicated as possible. We are involved in all the major trials when it comes to both aortic and mitral, and now soon to be tricuspid valves. Some of our proudest accomplishments is really some of the accolades and recognitions we've received. And one of our biggest ones is being ranked in the top 50 of US News in heart centers in the entire US, and that's a huge recognition. We're consistently nominated one of the best programs, and we've received both national and global recognition for some of our results, our outcomes, our processes, and our teams. Our program continues to stay on the cutting edge or lead the way in this by being involved in a lot of the research trials that we're in. We always try to evolve our process in the ways that we take care of patients so that we are beyond the guidelines. We're kind of the cutting edge of how to care for these patients. We have an incredible team. They're gonna get to meet a lot of the members of this team, and they're gonna realize there's a lot of people taking care of them, from when they're first scheduled to when they're coming in to meeting our nurses, to our valve clinic APPs, to the physicians, the surgeons. All of us are working together as a team to find the best solution for them individually as a patient.